Fourth, the employers and the employees don't want this burden on their backs any longer. The employers invariably go out every year and they shop around, right? And what do? They pay more and they get less every year. And they pass those losses on to their employees, who they either cut off or increasingly cost share the health insurance overhead for that company. Employees, the workers. Gallup did a poll a year and a half ago and found that up to 70% of workers were either somewhat or very unhappy in their current jobs. And yet, most of these folks don't dare let go of their jobs. Why? They lose their insurance. They lose their health insurance. They put themselves at risk, their families at risk. In other words, the healthcare system itself is a drag on the overall economy. It's not just the cost of the steel, but it's the cost of people not even being motivated to perform their jobs, not being happy, content, creative in their jobs. Fifth, we talked about capturing about 30 cents of every administrative dollar that's being lost, put it back into healthcare delivery. We also want to capture costs associated with what's called defensive medicine and kickback medicine. This is where doctors and hospitals prescribe medically unnecessary, high-cost treatments, MRIs, CAT scans, because they're afraid of the possibility either of a lawsuit or they're incentivized. They have an incentive to drive traffic to those units because it's part of their contract. That's about 10 cents out of every healthcare dollar we can recoup. And in fact, single payer is the single best tort reform. So if you're ever talking to a Republican and they say, oh my God, the cost associated with tort, it's destroying our healthcare system, people are getting these outrageous, frivolous lawsuits, settlements, and so forth, tell them that single payer is actually the single best way of bringing down medical malpractice cost-related issues, because the health care is covered. No matter what the outcome of a procedure, your health care is covered long-term under this legislation. So this will tamper down lawsuits, because people will at least be much happier knowing that their health care costs are covered. Our healthcare system in Pennsylvania costs about $100 billion. We estimate that we can save upwards of $50 billion. Half. We estimate, our economists estimate, that we're now wasting about half of our healthcare dollars. That's 17% of our economy. And we will generate new jobs. We estimate 140,000 new medical delivery jobs created in the new medical-centered economy of Pennsylvania. 50%, more than 50% of our hospitals are now running in the red. We will restore them to the black. 93% of our medical students who graduate from our 7 medical schools, 93% of them go where after graduation? Out of state. 10 years ago, the number was closer to 50%. The point is that we can retain our medical students and our future deliverers of healthcare. And the average retirement age now for physicians has dropped in the last few years from 64 to 59. We have a serious primary physician shortage in the state, and we'll rectify that with effective delivery of single-payer health care. What single-payer does, of course, is it eliminates the premiums, the co-pays, and deductibles, and it also removes the caps. That's where you go into medical bankruptcy. Most of us have $1 million cap on our coverage, and you blow through that with any sort of catastrophic, cancerous condition, extended hospital visit, in-house therapy, and so forth. That money goes away real fast, and when the insurance company says, you hit a ceiling, you're done, you're cooked. And then it's a race to the bottom, right? In order to qualify for Medicaid, you got to go broke. How crazy is that? And yet that's what the system has done to us. In place of paying premiums, co-pays, deductibles, and hitting caps, 10% business payroll. Businesses will pay 10% of payroll under our legislation. Compare that to what businesses now pay on average, 20 to 22%. So bringing down that cost from 20 to 10%. For individuals, we have a 3% tax. 3% of all sources of your income. What's the average Pennsylvania now pay for health care? The average? About 8%. We're actually bringing down the average cost for Pennsylvanians from 8% to 3%. And a lot of us spend in excess of 10%. I know that I do. So the funding for the system is based on 10% business payroll, 3% personal income tax, plus the dollars that we currently pay to Washington in the form of VA, CHIPS, Medicare, Medicaid, or federal dollars. We reabsorb those into the single-payer fund. So again, publicly funded, privately delivered health care for all. That's what single payer is here in Pennsylvania. Publicly funded, privately delivered. And anybody who asks, you tell them that's a centrist solution. A centrist solution. Public funding is an idea of the left. Private delivery is an idea of the right. That's a centrist solution. In fact, we enhance choice. We give you transparency. You're not confined to certain providers based on the terms of your HMO or your insurance company. So we emphasize greater choice. So for Republicans who tell you, oh, we need a consumer-driven response, single payer is that also. It's transparent, it's free market-oriented, use the terms, throw it back at them. This is what it is. It's a centrist solution. And then I'm getting toward the end here, very close. Bulk purchasing of pharmaceutical drugs, that authority is given to the state of Pennsylvania. Will bring down our prescription drug costs by more than 50%. Aren't people tired of going to Canada to repurchase drugs that are made in the Delaware Valley? Man, what sense does that make? 77 out of 78 industrialized countries in the world have bulk purchasing authority, and we're the only one that doesn't. In 2003, the government's hands were tied around Medicare, Prescription D, and now you have donut holes and catastrophe. It's been foisted on us by a campaign funding system that enables the politicians who enable the industry that enable the politicians. It's a vicious cycle. Aggressive infection control procedures, we can do a much better job in our hospitals. Dealing with problem doctors in hospitals, with problem doctors, hospital administrators and nurses. This legislation has teeth in it to de-license the outliers, those who aren't practicing industry standards. Right now, the litigation system actually protects bad apples. It really does. Restoring certificate of need, that's simply making sure that the hospital equipment is rationally distributed around the state of Pennsylvania. And transition to electronic records, something that's provided for in the Obama stimulus funds, so that we all have a medical home, we all know, all the medical providers know what your record is, less medical errors are made as a result. Emphasize primary preventive care, so that we can avoid these chronic, high-cost disease treatments and overuse and misuse of the emergency room. The emergency room is the primary care unit for about 1/3 of our population. They're either uninsured or underinsured. And K through 12 wellness curriculum. We want our children to have the best healthcare education. It's an investment in our future. My kids are 10 and 13 years of age. They tell me, Daddy, there's no food in the house. I say, guess what? We're going to go shopping together right now. I do the food shopping in our household. My kids, they pick up the products and they look at the labels. And they're actually learning what they're consuming, which is a great thing. I wish everybody could get that education. And then finally, for rural areas, I live in Plumsteadville, a rural area, $1,000 per year tax credit for our volunteer emergency responders, our first responders, our EMT and fire unit folks. Where I live, increasingly those positions are staffed by teenagers. I love teenagers. My daughter's a teenager. I was once a teenager, but if I'm having a heart attack, I'd really, really much prefer somebody who's dealt with that crisis condition, and so we need to keep these more seasoned volunteers in our midst, helping to serve our communities. These are serious proposals, and we're going to get this done with your help, and I'm deeply grateful for your attention. Thank you so very much.